Good evening, folks. This evening's topic is about children having TBIs, traumatic brain injuries, into adulthood and all the way up into elderly states. So here we go with tonight's explanation. Please join me for tonight's discussion D. In short answer, children who experience a traumatic brain injury, TBI, often face long-term mental and physical health challenges, including high rates of anxiety, depression, headaches, and chronic pain. And family resilience plays a key protective role in recovery. Impact of traumatic brain injury in children extends beyond the initial injury. A growing body of research shows that the effects of traumatic brain injury TBI in children do not end when the immediate medical crisis is over. Instead, many young people continue to experience significant emotional, behavioral, and physical changes or challenges months or even years after the injury. A new study published in JAMA Network Open underscores just how far-reaching these consequences can be and highlights the crucial role families play in shaping long-term outcomes. Persistent mental health impacts. Researchers analyzing data from U.S. children and adolescents aged 6 to 17 found that those with a medically diagnosed TBI and significantly higher rates of anxiety and depression compared to peers without such injuries. These mental health effects often emerge well after the initial trauma, reflecting disruptions in brain regions responsible for emotional regulation. Physical symptoms that linger beyond emotional challenges. Children with TBIs were also more likely to experience frequent headaches and chronic pain, symptoms that can interfere with school performance, sleep, and daily functioning. These findings reinforce that TBI is not solely an acute event, but a condition with potential long-term health implications. Why children are uniquely vulnerable? Because children's brains are still developing. Injuries can disrupt cognitive, social, and emotional development. This may lead to mood swings, academic difficulties, behavioral challenges, or changes and challenges in social interactions. Symptoms may not appear immediately, sometimes emerging 3 to 6 months after. The injury. Making ongoing monitoring essential. The protective power of family resilience. One of the most encouraging findings from the study is the strong association between family resilience and better mental health outcomes. Families that communicate effectively, manage stress together, and mobilize collective strengths can significantly reduce the risk of depression in children recovering from TBI. Supportive home environments help buffer the emotional and behavioral impacts of injury. Implications for care. Experts emphasize the need for routine mental health screenings, long-term follow-up, and family-centered recovery plans. Recovery happens in many contexts, including home, school, and community settings, where steady caregivers play a central role. Strengthening family support systems may be one of the most effective pathways to improving long-term outcomes for children with TBI. Research shows that infants who experience traumatic brain injury often have more severe, widespread, and persistent developmental challenges than toddlers. And although most studies track children only into early childhood, the developmental patterns they reveal, especially early disruption of communication, motor, and social emotional systems, are well established predictors of long-term cognitive, emotional, and functional difficulties that can extend into adolescence and adulthood. These early injuries don't simply heal with time, they can alter developmental trajectories in ways that echo across the lifespan. How early life TBI affects development and why infants may be more vulnerable. Children injured before 31 months are in a period of explosive brain development. During infancy, the brain is rapidly forming and punning synapses, laying down myelin and establishing the neural networks that support language, problem solving, emotional regulation, and social connection. A traumatic brain injury during this window can disrupt these processes at their most delicate stage. Across multiple longitudinal studies, two factors consistently shape outcomes: age at injury, severity of injury. Infants, especially those under 12 months, show greater vulnerability because their developmental systems are less established and more easily derailed compared with toddlers. Infants with TBI demonstrate larger and more persistent defects in communication, problem solving, and early cognitive skills. These are not small delays. They're, they represent foundational disruptions that can influence every late, later stage of development. Severe TBI is particularly concerning. Children with severe injuries often show flat or declining developmental trajectories across communication, gross motor skills, problem solving, and social emotional functioning. In many cases, there is minimal recovery over time, suggesting that early severe injury can set a long-term developmental course that is difficult to reverse. The starking and troubling finding, even when delays are clearly present, present, very few children receive early intervention services. In one cohort, only 5% of children access services, despite 28% showing low developmental scores. 1 year post-injury, this gap leaves many children without the support that could meaningfully alter their long-term outcomes. Most studies of infant and toddler TBI follow children for only 3 to 4 years, but the developmental patterns they document mirror those seen in broader research on early adversity and pediatric TBI. These patterns are strongly associated with later life outcomes, cognitive and academic impacts. Early severe TBI can disrupt the building blocks of learning, persistent defects in communication, problem solving, and motor coordination. Often evolve into executive function challenges, slower processing speed, difficulties with attention and working memory, academic struggles in reading, math, and complex reasoning. While direct infant versus toddler comparisons rarely extend beyond early childhood, the heightened vulnerability of infants suggests a greater likelihood of cumulative cognitive impacts as they move into school years and adolescence. Social, emotional, and behavioral outcomes. The social emotional system is especially sensitive to early disruption. Severe early TBI linked to emotional regulation difficulties, increased irritability of impulsive challenges, forming and maintaining peer relationship, higher risk of anxiety or depression in later childhood. Infants who show early social emotional delays may struggle more as social demands increase with functional outcomes into adolescence and adulthood. Although no study has followed infants and toddlers with TBI into old age, Broader TBI research shows that early neurological disruption can increase risk for lower educational attainment, employment instability, or underemployment, social withdrawal or isolation, chronic physical symptoms, including headaches, fatigue, and sleep disturbances. These patterns align closely with the developmental defects observed in early life TBI cohorts. Given that infants show more pronounced early defects, it is reasonable to infer that they may face greater cumulative risks across the lifespan. Why this matters for long-term health. Early childhood is a paradoxical period. The brain is extraordinarily plastic, yet also extraordinarily vulnerable when injury occurs during foundational developmental windows. The effects can cascade, shaping cognitive, emotional, and social development in ways that may persist into adulthood. The research strongly suggests infants are more vulnerable than toddlers to long-term developmental disruptions after TBI. Severe TBI produces the most persistent, wide-ranging effects or defects. Early intervention is critically underutilized despite the clear evidence of need. These early defects are known predictors of later life challenges. Even though direct studies into old age are not yet available. In other words, early TBI is not a one-time event. It is a developmental turning point. The earlier the injury and the more severe the disruption, the more likely it is to shape the child's long-term trajectory. Okay, guys, that is it for tonight. I will see everybody tomorrow evening for shows. For now, Gator Wellness. Take care, folks.